Hello, I'm Jeremiah Shaver, multimedia reporter for the Jackson County Times-Journal. In light of the recent Ebola scare here in Ohio, the Jackson County Health Department decided to host a press conference designed to inform the public here in Jackson County about Ebola. Now, the press conference was held at the Health Department on Thursday, October 16th, and Jackson County Health Commissioner Kevin Ashton gave a lot of good information. Let's listen in to hear what he had to say.
So, there are currently no cases of Ebola in Ohio, and I still think, and all my public health colleagues think, that Ohioans have a low risk of catching it. So, as you may have seen in the national news, the second U.S. case of Ebola was a nurse who cared for a sick West African man in Dallas, Texas, and then traveled to Akron, Ohio to visit her family on a plane, and then got on another plane a few days later and traveled back. And it's important to note that this nurse did not have any symptoms while they were in Ohio. And to transmit Ebola, someone that has it has to have symptoms. And I can kind of explain the physiological reasons of why that is. In brief, basically what happens with viruses is it gets in your cells and it multiplies in your cells, and when enough of it is inside a cell, it bursts the cell open, and each one of those viruses then go find a new cell and the process turns over. So once enough of that happens, you start to actually feel that happening. And in the case of Ebola, since it's a hemorrhagic fever virus, it's attacking your blood vessels and your capillaries. So you get things like the symptoms, which we'll go through in a minute. But basically the viral load gets high enough that you start to feel symptomatic, and it also gets to the point where it's transmitted, could be transmitted to somebody else. So since the nurse wasn't symptomatic while she was in Ohio, it's a very low risk of that being transmitted in Ohio. But we're still taking all the precautions that they can. So anybody that has been in contact with that person while they were in Ohio has already been quarantined. And the public health officials up there in the Akron and Cleveland area have been spearheading those efforts. They've also been working in conjunction with the Ohio Department of Health and the Centers for Disease Control and Prevention, the CDC. The CDC did send a team up there to assist. So it's really federal, state, and local all working together to identify and contain anybody that might have been exposed. And again, it's a very low likelihood that those people will actually develop Ebola, but just because there may be a very small chance, and with the philosophy that we're going to exercise an overabundance of caution, went ahead and isolated them. As far as anybody that might have been exposed on either of the aircraft that nurse was on, they've identified those people too, and so the local public health officials that work in those areas where those people live have contacted them and checked in with them and have said, okay, here's the situation. We're going to monitor you twice a day to see if any symptoms develop, and if that happens, again, right away, you're going to be isolated and you're going to receive immediate medical care. So that has been the guiding philosophy for trying to protect people here in Ohio. Once again, I've said it twice, I'll say it a third time. Even given all that aggressive response, it's still very unlikely that anybody in Ohio is actually going to get Ebola because of the situation. So I do not think that anybody in Jackson County has been exposed to Ebola, because no one from Jackson County or even this area of the state was on that airplane. No, so there's no reason at all that I'm at this point concerned that that would be here. So, just wanted to state that clearly.
Okay. All right.
If something changes, and I suspect that there may have been someone exposed to it here, I'm going to do the exact same thing. I'm going to communicate with state and federal authorities and we're going to follow the guidance that they've put out, which they've communicated across the state about how to handle those sort of exposures. And what we do then is likely quarantine whoever it was, just in case they may have it, and continue to monitor that and make sure that they receive immediate medical treatment if they start to feel sick. The incubation period is 2 days to 21 days.
Mhm.
So on the outside it's 3 weeks. So really these folks that have been quarantined are looking at about a 3-week quarantine just to be on the safe side.
Okay.
The average is about 8 to 10 days, so usually it doesn't take 3 weeks, but again, there's an overabundance of caution being exercised here with this response. So hopefully that can be communicated to the public, and the public takes heart from that. So, like we've said, the situation's been developing. So it started off that she started to get a fever the day after she flew from Cleveland back to Dallas. So again, if your viral load is not really to the level where you're able to transmit it to people, and you're probably not symptomatic, and those two things, go hand in hand. But sometimes it's hard to detect when you're having symptoms. Is a low-grade fever symptomatic? Is a headache? I mean, we all could have a fever of a headache, and not necessarily. So once again, Ohio has adopted a more strict definition of what signs and symptoms to look for than have been previously used. So just today, we've been taught to expect that a fever of greater than 100.4, which is only about a 2-degree fever, would constitute as a symptom. So the news was saying today that she may have started to have a low-grade fever the day she flew. So I'm sure that this stuff's continuing to roll out. So I don't speak with any authority on that sort of stuff there. What I can speak in authority of is how we deal with it, and how sort of the isolation and prevention measures that are going on in Ohio are. Ebola is definitely a dangerous virus. In Africa, where there's an epidemic of it right now in West Africa, the fatality rate for infection is anywhere from 50% to higher. It's it's bad news if you catch it. But the really important thing to always bear in mind is the way that it's transmitted. And it's transmitted through contact with bodily fluids. So what bodily fluids are we talking about here? We have to assume any bodily fluids, from blood to saliva to sweat, feces, vomit, semen, breast milk. Basically, it could be present in anything. So again, what I was talking about with that kind of the level of like the viral load and then the level of virus that's in your system, the way viruses work is they invade cells, they multiply in the cell until the cell's so full it bursts, and all those viruses then go and find new cells, and the process turns over. And once you get to a certain level, you get so much virus in your system that you start to feel that then. They've killed enough blood capillaries that you start to bleed out and bruise, which is one of the symptoms of a hemorrhagic fever. You start to have a fever. You might start to have diarrhea or vomiting or stomach pain, muscle weakness, headache. Those are all potential symptoms. So once that viral load is high enough, you might just start to feel it, and you might be infectious at that point. But it does not transmit through the air or through water or through insects or other mosquitoes. Again, with the philosophy that an overabundance of caution is what we're going to exercise, we're going to consider any direct contact that the two people had together, whether it's a hug or a handshake or something like that, as a potential exposure, and that's new. Let's say that I had Ebola and I go to shake Robert's hand. That normally would not be a transmission, because your skin is a barrier. between your bodily fluids and someone else's bodily fluids. And really the only way that that would work is if I had a break in my skin and Robert also had a break in his skin, and so that there was contact that way. But because we're going to exercise an overabundance of caution, just to make sure, anybody that has had a handshake with someone that has had Ebola, we're going to go ahead and act like they may have it and monitor them. And so, for instance, the family of this nurse that we talked about earlier, they've had direct contact with her. You know, they're family members, so they've been quarantined and they're going to be watched for the 21 days. As far as the plane goes, anyone who has sat within 3 feet for a long duration of time, they're going to consider to it being exposed. So I think a big question with this has been, okay, is this airborne, is this not airborne? It's definitely not airborne. It most certainly is not. However, your saliva is a bodily fluid, and potentially that virus could be in your saliva, so or even your sweat. So if you were sitting on an airplane next to someone for a duration, again, to err on the side of caution, we're going to treat those people like they may have been exposed, and again, watch them closely. But because it is not, and I repeat, not airborne, someone that's not right near you that could have been exposed to your bodily fluids is not at any risk of catching it. So someone, you know, farther away in the plane, or someone that you just walk by in the street, that's not an exposure. So the only way that any of those bodily fluids could get into your body is through a break in the skin or into one of your mucous membranes, like your eyes or your mouth. So if someone was actually sick with Ebola, they were symptomatic and able to spread it, and they were, like, you know, coughing right into your mouth or something, that would be the only way that someone could possibly spread it to you with it.
Could Ebola mutate and become an airborne virus?
So I talked briefly about how this is a blood, bodily fluid-based virus. So it's infecting, you know, endothelial cells, which make up your blood vessels and your veins and arteries and capillaries, and you know, your liver cells, and so it's fundamentally, you know, based in bodily fluids, and that's kind of its natural environment, not surviving outside of bodily fluids. So for it to make that sort of jump into kind of being able to, you know, survive in a new environment and be transmitted in a different way is a very big jump. Like, it'd be a smaller jump for it to be more or less deadly than it would be to jump to a new form of transmission. Would you agree, Dr. Knapp?
Probably, yeah.
Yeah. So it's really that, and I know people have questioned that, like, oh, it can mutate. Let me give you a counterpoint. Influenza, right? Totally different. It's like at the opposite end of the spectrum. It changes every year. It's part of its
Modus operandi.
yeah, it has little, it's part of it way it's a successful virus is that it changes every year, and it can beat your immune system every year, and it's constantly swapping traits and you know, coming back in a new version. So that's probably why people think that maybe this could be the same way.
But it stays respiratory.
It stays respiratory.
It stays
it's not like
respiratory.
influenza shows up the next year as bloodborne. No.
Or it shows up in your gut. Yeah, it's...
So really, it is very, in my professional opinion, highly unlikely that that would happen. So I want to highlight what I think are some important things to bear in mind during this situation, and that gets us to the second page of the press release that I prepared for you. So there's some really important differences between West Africa and the United States of America that really affect how this situation could play out. So I think an important thing to remember is that so there's no vaccine to prevent this, at least not yet, and I understand that that's under development, but still probably you know, a ways away. And there's no specific treatment for this other than to give supporting care, so like intravenous fluid and trying to keep, you know, support the immune system as it does its job. So it's really down to being healthy and having a strong immune system and getting access to modern healthcare like we enjoy here in the United States. It really makes a big difference. So if you're already not very healthy, or you're you're undernourished, and especially if you don't have access to healthcare and you can't get those IV fluids and some of that support that'll help you heal, that really makes a big difference on the fatality rate for an infection like this. So we're fortunate in the United States to have those sorts of resources. In contrast, in West Africa, they haven't had access to those sort of healthcare resources, and they've endured a long-term period of instability and chaos there. They don't have access to the same healthcare resources we do. They don't have a local health department to help guide a response and to investigate, cases and try to isolate them and stop the spread. In addition, Americans don't eat the sort of bush meats. You may have read about that in the news. That's things like bats and monkeys, and it would be the equivalent of if the average American household lived off of deer as their primary way of feeding their family. And if households had to go out and hunt deer to have dinner that night, this is what it's like for them in this part of the world. They go out and hunt these animals so that they can feed their families, and these animals are a reservoir for the disease. So as long as this practice is going on, they're going to keep having the source of exposure to it. So that difference has certainly propelled this epidemic. I've read there's been a distrust of healthcare professionals and of the government, so that when the proper advice about controlling the infection is communicated down, it's not listened to, and perhaps there's not as much trust as we have in healthcare providers in that part of the world as there is here in the United States. So you might have a situation where you're not seeking out healthcare. You prefer to not. And stay at home and have your loved ones take care of you, and then you end up spreading it to them because they're not trained. I also understand that they have different practices about how they handle their dead there in Africa, that the families take over the dead, and they're not taken to professional licensed funeral directors that know how to safely handle human remains. And all these things, I think, come together to exacerbate the problem that they're having there in Africa. And I think it's pretty clear that in each one of those things, that's not the case here in the United States, and those aren't challenges that we're going to have to face. And I think that's why I don't expect this situation to spiral out of control in the United States the same way as it has in Africa. Jackson County Health Department is working with state and federal public health authorities. I mentioned that. We're working closely with local agencies like the EMA, like Holzer Medical Center, like our Sheriff's Office, like our EMS, like all of our community partners, so that we're responding to this together, so that we all stay informed as the situation continues to develop, and so that it's we can, if by any chance any cases of Ebola show up around here, it's going to be a group approach to tackling them and getting the problem under control, if it does ever come here. So I think that we're going to be able to quickly detect any cases, investigate them, and minimize the spread of disease if it ever comes. So, and I attribute that to the good communication that I'm getting from my colleagues at the state and federal level, to the fact that we do have trained professionals here that do this, and that do it day in and day out every week for other infectious disease. So last thing I'd like to mention is that the Ohio Department of Health set up a 24-hour hotline to answer questions about this. So if any residents of the community want to try to call that and put questions to it, they're welcome to. That's 1-866-800-1404. And if you're really looking for a quote from me, I would say that The best way to handle the situation is not to fear it, but to understand it, and then to be prepared. And so that's what we're trying to do. That's what all the activity that I've described heretofore has been about. That's why I invited all of you here today, so that we understand it and we're working together to be prepared about it.